Assalamu alaikum. Beta, in this video lecture, I will deliver the lecture on Introduction to Cancer Genomics. Okay, that is all about the basics of the cancer genomics. Starting with this lecture, beta, what is neoplasia? Neoplasia is by definition the uncontrolled cellular proliferation leading to formation of a mass. एक सेल बेटा जब नॉर्मल से ज़्यादा मल्टीप्लाई करे वो भी अनकंट्रोल्ड फैशन में और उसके नतीजे में एक बहुत बड़ा मैस या ट्यूमर बन जाए तो इस प्रोसेस को हम नियोप्लेजिया कहते हैं और बनने वाले मैस को या ट्यूमर को हम नियोप्लाज्म कहते हैं. It can be sarcomas, it can be carcinomas or hematopoietic lymphoid malignant neoplasms. Sarcomas are the neoplasias that arise from the connective tissue cells. However, carcinomas arise from the epithelial cells. Understand? Sarcomas from the connective tissues like bony connective tissue, muscle connective tissue, and some soft tissues in the body. However, carcinomas, they do arise from the epithelium, the epithelial tissues lining your viscera. They can arise from the breast, they can arise from the liver, lungs, abdomen. Okay. And the hematopoietic and the lymphoid malignant neoplasms are the ones that arise from the hematopoietic tissue, that is the blood tissue in the bone marrow, and the lymphoid cells, right? Now, let's go a little ahead. Beta, what is the generally acceptable size of a tumor so that it can come to the medical clinical attention? It should be 1 gram, it should be having weight of 1 gram and exponent 9 cells. Exponent 9 cells, right? Exponent 9 cells. Division, that means 30 cells doubling. एक सेल जब 30 दफ़ा डिवाइड करेगा बेटा, एक सेल जब एक मरतबा डिवाइड करेगा तो 2 सेल बनेंगे और 2 सेल जब डिवाइड करेंगे तो देयर विल बी 4 cells and then from 4 cells there will be 8 cells, then 16 cells. So 30 times अगर सेल डबल हो और एक्सपोनेंट 9 टाइम्स, वो मतलब 30 टाइम्स सेल डबल हो और एक्सपोनेंट 9 सेल्स बन चुके हों और उसका ओवरऑल वेट 1 ग्राम हो चुका हो तो देन अ ट्यूमर कम्स टू द मेडिकल अटेंशन. ओके, नाउ molecular basis of the multi-step carcinogenesis. What is this, beta? This refers to the that many malignant tumors, they acquire multiple hallmarks of the cancer. What does it mean? It means that whenever cancer develops, it actually results from the stepwise accumulation of the multiple mutations that act in the complementary fashion to produce a fully malignant tumor. बेटा, जो एक मैलिग्नेंट ट्यूमर है वो डायरेक्टली एक मैलिग्नेंट ट्यूमर नहीं बनता, उसमें स्टेप वाइज म्यूटेशंस कलेक्ट होती जाती हैं. एक सेल से दूसरे सेल, दूसरे से तीसरे सेल में न्यू म्यूटेशंस ऐड होती जाती हैं और वो कम्प्लीमेंट्री फैशन में ऐड होती हैं और एज अ रिजल्ट there is the formation of a malignant tumor, right? Now, after this comes the concept of the driver and the passenger mutations. Driver and the passenger mutations, okay? Yeah. Before I tell you what are these mutations, let me quickly give you an example that just like in a car, there is a driver and there can be a passenger. Driver is really important component because it is driver जिसकी वजह से गाड़ी चलती है, गाड़ी प्रोलिफरेट करती है, आगे बढ़ती है, मूव करती है. और पैसेंजर बस सिर्फ he is like sitting alongside the driver. He has nothing to do with the growth, proliferation, movement of the car. Okay, he is just a passenger sitting and giving company to the driver. If he is in the car or not in the car will have no effect on the growth, proliferation and the movement of the car because it all depends on the driver. I hope you can follow here the same thing, right? The driver firstly there are passenger mutations. Passenger mutations are random, they are not recurrent mutations. However, the mutations which occur too frequently and are involved in the development or progression of the cancer, these are the driver mutations. Driver mutations are actually responsible for development of the cancer, progression of the cancer. Passenger mutations are just like sitting along with the driver mutations. They have nothing to do, okay? Right, I hope you are clear with this, beta. Driver mutations, why do they occur, beta? Driver mutations, why do they occur? These mutations, why do they occur in the genes? So that cells turn into malignant cells. This may be due to, insertion of some nucleotides, deletion of some nucleotides. There may be, chromosomal translocation, or it may be due to the chromosome shattering. Shattering refers to the fragmentation, fragmentation of the chromosomes, that is also called chromothripsis or catastrophes. Okay, chromosome shattering actually refers to like पूरे chromosome का जड़ सा जाना, ठीक है, shatter हो जाना. So insertion, deletion, translocations and the chromosomal shattering can be the reason behind driver mutations. I hope you are clear with this, beta. Let's go a little ahead. Okay. Yeah, here. Right. Mira, there are some genes. There are some genes and the factors that are responsible for the growth and proliferation of the cell normally. And once the cell has proliferated, then those factors stop the multiplication of that cell and lead towards the apoptosis, that is the death of the cell. So it is a stepwise thing. Number one, cell has to divide. Okay, some factors will help cell to divide, and some factors will help the cell to divide, and once the cell is divided, later what will happen? The multiplication of that cell will be stopped and then apoptosis will occur. That's the normal life of every human individual, every cell inside the human individual. Once it proliferates, cell cycle goes to high top, and then the cells differentiate and then undergo apoptosis. That's it. That's the rule of life, my son. So you can see at the top what is written here: cell cycle regulation, cell cycle checkpoint proteins, cellular proliferation signals. They all are related to cell proliferation. Okay, they all are related to cell proliferation. And what are the components, what are the factors that are involved in all these above three steps, which are regulating cell cycle, checkpoint proteins of cell cycle, cellular proliferation signals? All these three steps are actually related to cell proliferation. Na? So what are the factors responsible for all these factors? Cell regulation, checkpoint protein, signaling. They can be transcription factors. They can be receptor and membrane bound tyrosine kinases, some growth factors, and serine threonine kinases inside the cell, phosphatidylinositol triphosphate kinases, G proteins. I hope you are clear with this, beta. G protein and the coupled receptors. These are the serpentine receptors in the membrane, and the mTOR signaling, that is the mammalian TOR signaling. Okay, and the WNT beta catenin pathway, that is also a growth regulatory, growth promotory pathway. Okay, and there are some factors that are responsible for differentiation of the cell. There are some, that differentiates the cell. Okay, let's suppose there are some genes that are involved in the exit from cell cycle into G node. Actually, for example, the neuronal tissues, the neuronal cells, they do not multiply all the time. So there must be some genes that take the neuronal cells out of the cell cycle and throw the neurons into the G node phase. Okay, go and sit into the G node phase. You don't have to multiply anymore. You are differentiated cell, you are neuronal cells, and neuronal cells do not multiply. So there are some genes that order the neurons to get out of the cell cycle and go and sit into the G node phase, and you don't have to multiply anymore. You are a differentiated neuronal cell, and neuronal cells do not multiply. So there must be some genes that are responsible for differentiation and the lineage survival of the cell. Okay, I hope you are clear with this, beta. And then go a little ahead. Right. Now there is a concept of beta proto-oncogene and tumor suppressor gene. Just a second. Okay. There is a concept of beta proto-oncogene and tumor suppressor gene. Can you see in this picture the proto-oncogene, beta POG? POG. What is the function of the POG, proto-oncogene? It is, you can see, here. Okay. It is actually triggering the cell proliferation, right? And once the cell has proliferated, once the cell has proliferated enough, then there is a turn of tumor suppressor gene. Tumor suppressor gene will then stop the cell proliferation. Okay, this is what happens. The proto-oncogenes normally promote the cell proliferation, and once the cell has done with proliferation, then the tumor suppressor gene comes and stops the cellular proliferation. That's it. लेकिन अगर कुछ यूँ हो जाए बेटा कि अगर प्रोटोऑन्कोजीन के अंदर गेन ऑफ फंक्शन म्यूटेशन हो जाए, तो व्हाट विल हैपन, दिस प्रोटोऑन्कोजीन में अगर गेन ऑफ फंक्शन म्यूटेशन हो गई तो क्या होगा बेटा, सेल प्रोलिफरेशन बहुत ज़्यादा बढ़ जाएगी। सेल प्रोलिफरेशन बहुत ज़्यादा बढ़ जाएगी। और उसके अलावा अगर ट्यूमर सप्रेसर जीन में लॉस ऑफ फंक्शन म्यूटेशन हो जाए तो इट विल बी अनेबल टू स्टॉप द सेल प्रोलिफरेशन। सो अगर बेटा प्रोटोऑन्कोजीन में गेन ऑफ फंक्शन म्यूटेशन हो जाए तो प्रोटोऑन्कोजीन विल बी ओवर एक्टिवेटेड, इट विल एक्ट लाइक ऑन्कोजीन, नॉट प्रोटोऑन्कोजीन एनीमोर। इफ देयर इज म्यूटेशन इन द, if there is mutation in the proto-oncogene, it will become oncogene, and oncogene will keep on triggering the cell proliferation cell cycle every time beta. And also if there is concurrently the loss of function mutation in the tumor suppressor gene, loss of function mutation in the tumor suppressor gene, so if there is loss of function mutation in the tumor suppressor gene will be unable to stop the cell proliferation. तो ऊपर से प्रोटोऑन्कोजीन में म्यूटेशन की वजह से वो लगातार सेल प्रोलिफरेशन करा रहे हैं, और नीचे से ट्यूमर सप्रेसर जीन क्योंकि वो लॉस हो गए हैं तो वो सेल प्रोलिफरेशन को रोक भी नहीं पा रहे हैं। तो इसके नतीजे में क्या होगा, बहुत ज़्यादा सेल प्रोलिफरेशन होगी और ट्यूमर फार्मेशन हो जाएगी बेटा। ठीक है, नाउ फ्यू क्वेश्चंस दैट मस्ट बी कमिंग इनटू योर माइंड कि जो प्रोटोऑन्कोजीन्स हैं इनमें गेन ऑफ फंक्शन म्यूटेशन जो होती है बेटा, वो क्यों, मतलब किस तरह से होती है, क्या म्यूटेशंस होती हैं प्रोटोऑन्कोजीन्स में, क्या म्यूटेशंस होती हैं प्रोटोऑन्कोजीन्स में कि वो ऑन्कोजीन्स बन जाते हैं, और क्या म्यूटेशंस होती हैं ट्यूमर सप्रेसर जीन्स में कि उनकी एक्टिविटी लॉस हो जाती है। बेटा प्रोटोऑन्कोजीन्स में जो गेन ऑफ फंक्शन म्यूटेशंस होती हैं जिसकी वजह से वो ऑन्कोजीन्स बन जाते हैं और वो सेलुलर प्रोलिफरेशन जो हद से ज़्यादा हो जाती है, इसके पीछे रीज़न बेटा जीन एम्प्लीफिकेशन हो सकता है, chromosomal translocation and point mutations. And the tumor suppressor gene, the reason why their activity is lost, it can be the missense mutation, nonsense mutations, some frame shift deletions, and there can be the loss of the part or even entire chromosome, or epigenetic transcriptional silencing of the gene by the microRNAs, that are the miRNAs. miRNAs may be responsible for epigenomic transcriptional silencing of the genes, leading to the silencing of this gene, and this gene will not show its function anymore, so it will be lost. I hope you are clear with this concept beta. So let's go a little ahead. There comes the concept of beta cancer in families. Remember beta, there are some individuals, obviously all the time you are at risk of developing some cancer at some point during your life, but there are many forms of the cancer that have higher incidence in the relatives of the patients rather than in the general population. This is very important point. Let me tell you beta, look beta, every individual in this world is obviously all time at risk of developing some cancer, either 0.001% risk or some high risk, but each individual is at risk of developing the cancer. But don't forget beta, there are some cancers that are more common in the families, that are running in the families rather than in the general population. If let's suppose, if I take an example of the breast cancer, so if my grandparents were suffering from breast cancer, and my parents also had breast cancer, so I might also develop the breast cancer. However, the incidence and the risk factor of the breast cancers in the males is very low, I think, in the general population. In general population, the risk of breast cancer is not that high. It is low in males. But why am I at high risk of developing breast cancer? However, it is having low risk. Because I am actually the relative of that patient. So वो जो mutations हैं वो from my grandparents to my parents and then in me. Okay, so this is the reason कि breast cancer in males, however, it is uncommon, but it is still I am at high risk. Why? Because I belong to that family where the mutations responsible for the breast cancers are running in the family. Okay. For example, there are some familial cancers that run in the families. For example, multiple endocrine adenomatosis. This is the former name. Now it is called multiple endocrine neoplasia. That is MEN type 2. It is of two variants, the type A variant and the type B variant. Type A variant is more common. It is autosomal dominant. Type B variant is rare beta. Type A variant is characterized by multiple malignancies like the medullary carcinoma along with pheochromocytoma or benign parathyroid adenoma, or both of these. Okay. and type B variant is characterized by the presence of the neuromas. Okay, this multiple endocrine neoplasia type 2, this is uncommon in the general population, but if you belong to the family where this condition is running in the family, so you are at high risk. Okay, and the mutations beta that are responsible for development of the men type 2 are mutations in what gene? Rat gene beta. Okay, let me give you some other examples of the familial cancers. For example, the beta breast cancer. Breast cancer occurs due to mutations in what genes? BRCA1 and the BRCA2 genes. BRCA1 and BRCA2 genes. These are really important genetic mutations in case of the breast cancer. So, okay, let me again give you the same example. Okay, there is person A who is my friend and he is not my relative. Person A is my friend and he is not my relative. And person B is I myself. If let's suppose in my family, person B, myself, if my grandfather had breast cancer and my father had breast cancer, and am I at high risk of developing breast cancer? For sure, I am at high risk of developing breast cancer. And as compared to me, person A, my friend who was not actually my relative, is he at high risk of developing breast cancer? No, because he comes in the general population and I come into that line of the family where the mutation is running. I hope you are clear now, beta. Right. Other than beta breast cancer, there is another very good example, that is the hereditary colon cancer. इसके तो मोस्टली बेटा स्पोरोटिक केसेस ही होते हैं, लेकिन स्मॉल प्रोपोर्शन ऑफ द कोलोन कैंसर्स आर फैमिलियल एज वेल. ओके, विच रन इन द फैमिली एंड इसका इनहेरिटेंस पैटर्न ऑटोसोमल डोमिनेंट होता है. हेरिडिटरी कोलोन कैंसर्स इंक्लूड बेटा फैप, दैट इज द फैमिलियल एडिनोमेटस पॉलीपोसिस एंड द लेंच सिंड्रोम. ओके, इसके वैसे स्पोरोटिक केसेस ज़्यादा होते हैं जो जनरल पॉपुलेशन में होते हैं बेटा, लेकिन फैमिलीज़ के अंदर भी ये होता है. मैं एक क्विकली बेटा छोटा सा कॉन्सेप्ट आपका क्लियर कर दूं कि एक होता है स्पोरोटिक, एक होता है फैमिलियल. ओके, फैमिलियल कैंसर्स वो होते हैं बेटा जब जेनेटिक म्यूटेशंस आपकी वेरी फर्स्ट सेल जाइगोट से ही प्रेजेंट हों, जाइगोट में ही म्यूटेशंस हों. अब ये म्यूटेशंस कहीं से भी आ सकती हैं, फ्रॉम फादर भी आ सकती हैं, या फिर अब यानी फादर फ्रॉम स्पर्म से भी आ सकती हैं म्यूटेशंस, या फिर दे कम फ्रॉम योर मदर, दैट इज़ फ्रॉम ओवम. हो सकता है जेनेटिक म्यूटेशन स्पर्म में मौजूद हो सकता है जेनेटिक म्यूटेशंस ओवम में मौजूद हों. तो जेनेटिक म्यूटेशंस बेटा स्पर्म या ओवम के थ्रू जाइगोट में आएंगी और जाइगोट से फिर इनटू द ऑल द सेल्स ऑफ द बॉडी. ये म्यूटेशंस बॉडी के सारे सेल्स में रहेगी, एंड इफ इट इज़ रिलेटेड टू ब्रेस्ट कैंसर यू विल फॉर श्योर डेवलप ब्रेस्ट कैंसर. ओके, as compared to familial, sporadic variety is when the mutations are not present from the zygote. They are acquired mutations. You do not carry these mutations from your parents. These are not present in the sperm of your father. These are not present in the ovum of your father. They are not present in the ovum of your mother. So these mutations are actually absent in the zygote. So actually the sporadic conditions develop when you do not carry mutations from very first cell of your life. The sporadic conditions occur when mutations are acquired in your adult life, okay, in any cell of your body, not from the very basic cell zygote. Okay, what happens beta? Zygote then develops into thousands of cells, and out of those thousands of cells, any time in your life when you are 30-year-old, 40-year-old, any of these cells may develop a mutation and you may develop the condition that will surely be sporadic and not familial. After this beta, few more terms to be, that should be cleared. Here we go. Yeah, just a second. Let me zoom into this. Okay, there we go. There are some genes beta for your exam purpose you have to keep in your mind that are responsible for certain malignancies. For example, RB gene, it is responsible for the retinoblastoma of the retina of the eye. P53 is the tumor suppressor gene. अगर ये mutated हो जाए तो you will develop the Leaf-Romani syndrome. And if there is mutation in this P16-INK4A gene, it is possible that you may develop a skin condition called melanoma. And if there is mutation in the APC gene, you may develop the familial adenomatous polyposis or the colon cancer. Similarly, there are some other genes like neurofibromatosis 1, 2. So if these genes are mutated, you can develop the condition called the neurofibromatosis 1 and 2. If there is mutation in the BRCA1, BRCA2 genes, these are really important genes responsible. If they get mutated, they can lead to the breast and the ovarian tumors. And MEN1 and the red gene, if they get mutated, you can develop MEN2, which I just discussed. MSH2, MLH1 and MSH6 are some genes. If they get mutated, you can develop HNPCC, that is the hereditary non-polyposis colon cancer. And the PTCH gene, if get mutated, this can lead to NBCC, that is the nevoid basal cell carcinoma syndrome, characterized by multiple basal cell carcinomas on the skin. P10 gene, if it is mutated, you will develop the Cowden syndrome. Okay, and LKB1 is responsible for Peutz-Jeghers syndrome. These are actually the epithelial cancers. And if the VHL gene is mutated, you will develop beta RCCs, that is the renal cell carcinoma. Right? So let's go a little ahead beta after this. Yeah. One thing that I have to clear here is beta, I told you previously that there are some proto-oncogenes. If they get mutated, they will become oncogenes, and these oncogenes are responsible for very much uncontrolled and increased cellular proliferation that will lead to the formation of tumor. So what are those mutations that occur in the proto-oncogenes so that they become oncogenes? I have told about this previously, that they can be gene amplifications, they can be point mutations, and they can be chromosomal translocations. Okay, a very good example of the gene amplification is the gene amplification in the NMYC gene. NMYC gene is a proto-oncogene. अगर इसमें amplification हो जाए तो it will lead to uncontrolled proliferation and the formation of neuroblastoma. ERBB2 is a proto-oncogene. अगर इसमें gene amplification हो जाए तो it will lead to uncontrolled proliferation and ultimately development of breast cancer. ओके इसी तरीके से पॉइंट म्यूटेशंस भी हो सकती हैं प्रोटो ऑन्कोजीन में, जिसकी वजह से वो ऑन्कोजीन्स बन सकते हैं. द फर्स्ट एक्टिवेटेड ऑन्कोजीन was the RAS gene from the bladder carcinoma. This is for historical purpose and for your exam purpose. This can be a very good point कि पहले कौन सा प्रोटो ऑन्कोजीन था जो डिस्कवर किया गया था कि हाँ भाई ये प्रोटो ऑन्कोजीन है, इसमें म्यूटेशन हुई, ये ऑन्कोजीन बन गया. दैट वाज अ RAS जीन ब्लैडर कार्सिनोमा में. ठीक है बेटा. Alongside gene amplification and point mutation, there can be a role of chromosomal translocation for the, turning your proto-oncogene into, oncogene. Translocations, the best known example is translocation between the chromosome number 99 and chromosome 9 and chromosome 22. So there will be, sharing. Some component from chromosome number 9 will shift to chromosome number 22. There will be two genes, BCR and ABL. So they will be fused, and this will lead to formation of the Philadelphia chromosome and will lead to development of the malignancy, that is the chronic myeloid leukemia. Okay, so there are three conditions or mutations that are responsible for the mutation in the proto-oncogene leading to formation of the oncogene and ultimately the uncontrolled proliferation. There can be gene amplifications, point mutations, or translocations. I hope you are clear with this beta. I will continue the lecture in the part 2 of the video. Thank you so much.